My name is Marsden McGuire. I'm a geriatric psychiatrist, and my position in the VA is Director of Continuum of Care and General Mental Health. The concept of the continuum of care is that we all have different levels of need as individuals when we're interacting with the healthcare system. So with this continuum, we believe we can take care of all veterans' needs at the appropriate level, but no higher level than is necessary.
The pyramid represents the continuum of mental health care, and the most important part in my mind is the bottom of the pyramid. And it is founded on our commitment and our belief in protecting, promoting, restoring the mental health and well-being of veterans through a whole health, person-centered approach. Moving up, a key thing that we have in VA is our primary care mental health integration. We have mental health providers integrated in all of our primary care teams, our patient-aligned care teams at all of our medical centers and our large clinics. The next level up in the pyramid, we have general mental health clinics available to veterans, people who may want to come in for psychotherapy, some counseling, maybe looking at some medications, whatever it might be to deal with a mental health issue or challenge that they may be having. Above that, we also have outpatient intensive programs. Particularly, I would highlight for both PTSD, post-traumatic stress disorder, and substance use disorders. And this is an opportunity to perhaps come in and be in a group of veterans a few times a week, to really work through some tough challenges together. At the top of the pyramid are our residential programs and our inpatient mental health programs for people who really need their whole environment to be, focused on them and focused on keeping them safe and helping them work through challenges.
We have an electronic health record which integrates care within a facility so that if you're being handed off from one level of the continuum to another, that information is passed instantly. And then if you're seeking care at another VA facility from where you usually get your care, similarly that information is instantly accessible. So that means that there's no lack of information when care is transferred from one team to another, whether it's in the same facility or across the country. And that's a benefit that no other health system offers.